Many of the patients that come to see us at Richmond Bone and Joint Clinic are physically active. From time to time, things happen, pains, injuries. But one specific injury we want to talk about is injuries to the fingers. The finger is a pretty simple, complex, at the same time kind of mechanism joint. One thing we always want to be concerned about is something called a PIP joint, or the middle knuckle. What happens, you can be reaching for something, they throw a ball at you, your finger makes a funny clunk kind of noise, right away you grab it, it hurts. What happens is, if this is the distal end or the fingernail end of your finger, what happens is that joint can actually bend and doot, and it causes a problem. One thing you want to remember though is, as you hurt a finger, you want to think about, have you hurt it before? Sometimes people just go, it's nothing, and we'll just walk it off. Sometimes there can be an obvious deformity. Sometimes you get a boutonniere fracture. You can actually get a spiral fracture where the finger turns one way because of the way that it's broken. But let's say it's a simple injury where you just kind of hurt, you're looking for some immediate first aid. Obviously ice, we recommend ice for all acute injuries, 24 to 48 hours. One simple thing you can do is you can buddy tape your fingers. Just get some small tape, cut strips of tape, and you want to support above and below that particular joint. And by buddy taping that finger, if you've injured this finger, every time you move the non-injured finger, it will bring that other one with it. And usually that's a good way to get that range of motion back. Obviously, control swelling with ice, over-the-counter medications for pain control. If it's a severe injury, we'd love to see you, rbjc.com. Remember, watch for the injuries, watch for a natural deformity as a result of that injury. Obviously, if there's any fracture that's coming out from the skin, that's an ER visit. But anything else, give us a call, we'd love to see you. Remember, rbjc.com.